All right. My name is Rosalind Young Daniels, and I do have one housekeeping thing to do. One request. Please like us on Facebook. It means so much. It means that we can keep in touch with you after today. We can send you content. You'll see these videos. Everything will be shared. So get your phones out. I know you brought them. So please, and also hashtag Black Health Matters as you take pictures and share all that you've experienced today. So now I am thrilled to talk with you about a disease state that a lot of us don't know about. And we are so pleased to have Dr. Sheri Prentiss with us. And I'm going to let her introduce herself, and then we'll begin. Dr. Sheri, tell our Facebook, our Black Health Matters family a little about yourself.
Well, I am Dr. Sheri Prentiss. I'm a 14-year breast cancer survivor, and I have been working with Black Health Matters now for some time, and Rosalind has become such a wonderful advocate, friend, and role model, and I'm honored to share the stage with you today. And before we get going, I want to have a couple of disclosures, and I'm going to put on my disclosure voice. Dr. Sheri Prentiss is a paid consultant by CN. CN is the marketing agency engaged by GSK. Okay, now we're about to have some fun. We got over that. So now we're going to have a casual conversation, right?
Yes.
About this whole thing about shingles and Black Americans 50 years of age and older, and why we should even care.
Well, those are great things that we should think about.
Think so?
So I am starting to hear a little bit more about shingles. I see it in the radio, on television. What is shingles?
Well, shingles is a painful, blistering rash that can occur, and it usually will occur like along a nerve path, and it can appear as these painful, blistering rash that can either occur like in a stripe on the left or the right side of the body. It can occur on the face, on the torso, on your arms, or on your thighs. And if it happens around on your face, it can occur around your eyes and your ears.
Oh my goodness.
Awful, awful. It's not something that you want to get, let me tell you. It's not something you want to get.
Well, I'm going to ask the $64,000 question. Since we're all here at Black Health Matters, do Black folks get this disease?
Honey, let me tell you. Okay, first of all, before I go on, I want those of you, if you can, I want you to look, just take a look to your right. And then I want you to take a look to your left. 1 in 3 people will get shingles in their lifetime. That includes us Black folks. Yeah, 1 in 3 will get shingles in your lifetime. And yes, 99% of Americans, 99% of us, are already carrying the virus that causes shingles in our bodies. And you know what?
What?
Shingles is caused by the same virus that causes chickenpox. It's called varicella zoster virus. And whether you remember having chickenpox or not, again, that virus, 99% of us 50 years of age or older, that includes me, y'all. I know that was a surprise, right? Y'all like, she over 50? Thank y'all. But yes, 99% of us 50 years of age or older are already carrying this virus in our bodies. And 1 in 3 will get shingles in their lifetime.
So maybe it's because we were children when we did have shingles that we don't, chickenpox, that we may not remember how distressed our situation was. I mean, I do remember the fever and have to staying home from school.
Right.
And again, the rash.
Oh my God.
Wanting to just scratch all day long.
Scratch.
It's
Oh my
awful.
God, yes. And you can possibly remember that there were times that when you scratched those fluid-filled blisters that happened when you had chickenpox, that after a while that area became painful because it's like you opened up a sore, right? And so with this rash, with shingles, you may find that it may start off initially as like pain and itching, right, in the area where the rash will appear. Then all of a sudden, you now see this rash that appears like a stripe because it's following a nerve path. You can almost see where the nerve innervates the skin and the muscle and anything up underneath it, because you can see the line of the rash developing. And yes, by the time you get these fluid, blistering filled blisters and rash on your body, man, it has taken effect. And now you're dealing with shingles. And you know how you said you remember the fever and the rash? Well, some other symptoms that you may get with shingles, it could be you can have headache, you can have fever, you can have chills, you can even have stomach pain. But the bad thing about it is that there are things that can happen even after the rash is healed.
Well, if I scratch that rash trying to make myself feel better, am I going to leave scars?
You can leave scars. And that was that whole thing. And those of you that had chickenpox when you were younger, I remember having chickenpox when I was younger. And you remember that pink lotion that you had to put on, turned all white and cakey and messed up your sheets and stuff? Didn't really do much good. It felt soothing when you first put it on, but it didn't seem to last very long. But yes, you can have scarring. And one of the most important and most frequent complications that you can have from shingles is a condition called post-herpetic neuralgia. And that is pain that appears along the area where that heel rash is. And I mean, I'm telling you, it can cause severe pain that lasts for months or years after shingles has healed. But you're left with this post-herpetic neuralgia, which is a painful area in the area where the rash was. And for some people, if that rash occurred like on your face, like around the eyes, you could have vision problems that will persist, possibly for the rest of your life.
Oh my goodness.
There are even people that, because it can occur on the arms and on the thighs, right? There are some people that end up with partial weakness or paralysis as a result of having shingles.
Now, is it considered a flare-up? What caused it? I know I worked with a woman, and we were working in a very stressful environment. You know how you have like the boss who's like the creature from the deep, and they are constantly checking you and just making your days miserable? And I saw that this woman would go out on leave for shingles. What causes that? What makes it flare? What makes it come to the surface?
That's a very good question.
After it's been dormant.
After it's been dormant. See, well, first of all, as we age, our immune system weakens. So it makes it more difficult for our immune system to fight against this reactivating virus. Yes, stress, trauma, anything that can impact your immune system, and then you add on the fact that our immune system is weakening as we age. So over 50, your immune system has weakened to a degree that it possibly may not be strong enough to fight off this reactivating virus. That's why it's so important, if you're 50 years of age or older, to really think about, what am I doing to protect myself from getting shingles? Because simply just by aging, even if I had you for a boss, best boss in the world, right?
Right.
There we go. And everything was great in my life simply because I'm now 51, I am over 50. My immune system is weakened. And if you take someone like me, who's a breast cancer survivor, my white count remains below 3. So I'm already immunocompromised. So I need to be smarter about what I'm doing and being proactive about my health and preventing something that is preventable. Why would I subject myself to something that I can take control of?
No, so true. So how smart is my doctor? Because my doctor has never brought this up to me.
Well, I am a physician, so I do not like talking about my counterparts. However, I say this. You know, when I was diagnosed with breast cancer, in that moment, I became a patient. And I informed my oncologist, do not talk to me as if I am a physician. You can use certain medical terms because I'll understand them, but I need you to appreciate that in this moment, I am a patient. And what it meant was, at the time, since I'm now taking care of patients at the same time, life was happening to me. And so I'm grateful that I made decisions that did not have a permanent impact on patients, but I know that the patients that I did see during that time probably did not get my 100% because life was happening to me. And so if your physician has not brought it up to you, one, if everything else has been good, you know, a little slap on the hand, because life is happening to that physician as well, just like life is happening to your pastors, your husband, your wife, and your children. So that's why coming to events like this is so important, because you have the wherewithal to advocate for yourself. And so now, instead of coming on to them hard, just say, hey, you know what? I went to this fantastic health summit by Black Health Matters. Oh my God, I learned so much that day. But one thing I really did learn about, and I'm over 50, so I want to make sure I take care of this. Talk to me about what I need to do about shingles. And I promise you, if you bring it up to your doctor will go, oh, I'm sorry, it didn't pop up in Epic to remind you. Oh, I thought the nurse was going to bring it up. Oh, I thought it was the patient navigator. Oh, I thought you already had it. Well, it doesn't matter. You're going to get it now. There we go. That's how you take care of that.
All right, so we got to show up.
You got to show up.
So as of course, again, if you're over 50, you have your checklist of things that you ask your physician, and asking them about the shingles. Shingles as a condition is something we should just bring up to them.
Absolutely.
Because you just never know.
You just never know. And here's the beautiful part about it. Let's say, because I know that there are a lot of individuals, and I'm going to jump on my men right now, especially single men who don't have wives that's going to force them and get them to the physician and get them to the doctor's office. There are many of you that have never laid eyes on a physician. And because God has blessed you to be healthy, and you have no intentions of going to the doctor's office. But some of you may pop up every 3 months, 6 months to get your prescriptions refilled if you have a diagnosis. Guess what? Even if you're not on any medications, when you go to Walgreens or CVS or, you know, Mariano's, wherever you have a pharmacy, and you just going and picking up some food or some chips because you don't have any prescriptions to pick up, stop by and ask the pharmacist, you know what, I heard about shingles. Is this something that I can do? Your doctor and or your pharmacist are more than capable of giving you the information that you need to help protect yourself. And prior to doing so, go to whatisshingles.com. Find out more, get a little bit more detail. Maybe there was something that I left out. But arm yourself with that knowledge, because you can go to that website, get exactly what you need, turn around, go right to your physician's office and or to your nearby pharmacy and get exactly what you need to protect yourself. But if you are 50 years of age or older, know that 99% of us are walking around with the virus already in our nervous system that is just lying dormant, waiting for the opportunity to reactivate and potentially wreak havoc in our lives. We don't need it, we don't want it. God has given us a way out, so let's take it.
Well said, well said. Well, you know, you can also find this great information on a wonderful website called blackhealthmatters.com. We cover that as well. So it will be there for you to look. Now, when you have this and you have a conversation with the doctor about it, what are the types of responses that he might have?
Okay. Your physician may say something to you like, well, you know, what have you read about it? What do you know about it? They may ask, do you recall having chicken pox? And let's say by chance you happen to come across a physician. I don't know one in this world that would say this. But if you say, no, I don't recall having chicken pox, and if that physician says to you, oh, okay, well, then don't worry about it. Run. Because it doesn't matter whether or not you remember having chicken pox at all, because 99% of us 50 years of age or older are walking around with the virus in us. So they may tell you about what to expect. They may mention the pain. They may mention the rash. They may even ask you, you know, do you know anyone in your family? Did you see anyone go through it? Because a lot of times individuals that have had family members that have been impacted by shingles, they're more reactive to get the help that they need because they've witnessed it firsthand. Sometimes in talking about it and just hearing about the symptoms, they don't sound so severe, especially with the things that we are battling in our lives right now. I think if someone had talked to me about shingles while I was going through chemo, I just was like, yeah, child, baby, I'm going through chemo. You talking about a rash? But now that I'm over that, oh, baby, now I can appreciate. And when I hit 50, that was definitely something that I wanted to make sure I took care of. Just like we, take care of our breast health, our prostate health, our cervical health, we got to take care of other aspects of our health. And there are certain things that you can do to prevent certain conditions, and this is one of them. This is one of them. It's been around for years and years and years and years, decades, and we have the opportunity not to have to be inflicted with something that can be preventable.
So let me ask the audience, can I get a show of hands? How many of you all have heard about shingles?
Nice.
Interesting. And can I ask, do you know of someone who has had shingles?
Whoa. Whoa. That's significant. So we're preaching to the choir, right?
Well, I guess the next question would be HIPAA. We can't ask. But have you had, but we can't ask. We won't ask, but that is significant.
Huge.
So I have to ask you all, had anyone ever spoken to you prior to you having it about shingles? Okay. So would you say it kind of took you or your friends or your family members by surprise?
Wow. Yes. So am I to understand, how many of you have had a physician or a nurse practitioner or someone in the healthcare field to talk to you about shingles? Oh. Okay, well, I know this is not quite necessarily HIPAA related. How many of you did something with the knowledge that they shared with you about shingles? Therein lies, there was a little bit of a difference. See, she had a physician that was persistent, that stayed on her to make sure every message. Now that was a blessing. Everybody doesn't have that. Plus those two. Yeah, us nagging, cheering, we do it.
Well, what I know, again, what you're saying is that when you do get it, it really is debilitating. It's something that you just don't want any parts of.
You don't, and you got to consider that it's not just, oh, I get a rash. When those blisters occur, you don't need to be around any other individuals. You become infectious. Think about the time off from work. Think about if you're just recently retired and you have fishing trips and all this other stuff lined up. Guess what? There is a great likelihood that that'll get canceled. Your time with your grandchildren, you just had a new baby grandson that was born and you're expecting to spend time with him, and now you're with shingles with this rash. Guess what? You cannot. So it's not just about the health issues and health challenges that you may be inflicted with, but it's also your lifestyle, what changes, how it impacts, how you interact. And I don't know about you guys, but the latter half of my life is the best part of my life. And I'm not trying to live it sick, broke up, scratching, in pain, with scars nowhere on me. Because I got scars now from my cancer that I get to hide. I'm not trying to have a scar on my face. You know what I'm saying? Because you're trying to be as cute as you can for as long as you can when you get past 50.
Amen.
Amen. Amen.
So true.
Amen.
So we have a few minutes left. So do we have some questions from the floor? We don't have to be
We
shy.
explained this so well.
Okay, we have one.
If you are under 50, what should you do?
If you are under 50, you should be prepared that at 50, you're going to do what you need to do so that you don't get shingles. And now, if you're under 50 and you've heard this message, You're going to go out and share this message to people that you know who are 50 years of age and older and ask them about their knowledge of shingles. And you're going to keep on informing the individuals that are under 50 about shingles so that when they turn 50, they would have heard it so much from you that they're going to do what they need to do. Got another question? I saw her walking with the mic, and then we're going to get you up front.
I was curious, does the vaccine, is it just one shot or two shots? How does that process work?
You know what? I would have to defer to a family practitioner about specifically, because we're here today to really lay the groundwork to understand what shingles is, the complications that can arise, the discomfort can arise, so that when you go to your healthcare practitioner, you can ask those specific questions. But today we really are just laying a groundwork so that we understand what health is like when you're 50 plus.
And I will tell you this, the process is quick.
Thank you.
When you speak to your physician or your pharmacist, it's a quick process, and that nice, good-looking man that asks the questions, I can tell you, you gonna handle it like a charm. You're gonna handle it like a charm. All right, beautiful, thank you.
Thank you. Thank you for this presentation. I am familiar with shingles, but there's so much about it that I still don't know. So I'm just curious, is there a difference in prevalence between men versus women? And is there a disparity between Caucasians and African Americans?
Oh, great question. The question between men and women, I'm not sure. I don't see any genetic makeup or anything that would cause it to be different, so I don't believe there is any difference between men and women. With regards to the disparities, the reality is because of the social determinants of health, we're behind the 8 ball in pretty much all things health. Just about. So you can pretty much count on, that's why we're having this conversation through a dynamic organization like Black Health Matters, because we have to get more of the word out. We have to get word out not only just to make individuals aware, but we need to break myths. We need to give individuals the right information so that they can take control of their health, and to realize and not expect that everything you need is going to be presented to you by your healthcare practitioner. Because again, life is happening to that person, or you may be in an environment where they're expecting, hey, it's your health, you do what you need to do. If you don't ask me the questions, I'm only going to address what you come in here to ask me. So advocate for yourself. But yeah, we are behind the 8 ball.
Quick follow-up.
Yes.
And once we get vaccinated, are we still at risk?
Oh, no, when you do take the proper steps that is required to help prevent you from getting shingles, you're good, like with pneumococcal vaccine, COVID vaccine, or any other treatment, but nothing in the world is 100%. Birth control pills been around for a gazillion years, and they still haven't made it 100%. But you do what you can do to minimize and decrease your risk. That's what you're taking control over. Your health, your life, your risk. Any further questions? So remember, go out to
We have one more,
we have
just
one
one
question.
more, just
Yes.
one more. Sir, do you want to, Tamara, you want to grab the mic? Or?
So 50, is that just a magical number, or is there instances where someone below 50 can get an occurrence of shingles, or is it someone can happen even later in life? So has 50 been a medical determinated number, or they say in general by the time you're 50, this is when you need to become most aware of the onset of shingles?
Fantastic question. Yes, there are individuals who are under 50 that get shingles. Do not think that if you see a 25-year-old walking around with a rash that's in a stripe that, oh no, that may not be shingles. Yes, if you're below 50, you can get shingles. What makes 50 that magical number is the impact that just getting older is having on our immune system. It's that 50 that sets that mark as far as we're seeing in the decrease in our immune system in being able to fight off a reactivation of this virus. So that's why the 50 kind of kicks in as that magical number, that 50 and older is when you really need to take control. But yes, it does occur in individuals under the age of 50, and yes, you could be 80 or 90 and get it. And you're talking about somebody making somebody bedridden at a certain age, and you add on certain comorbidities like high blood pressure and diabetes and anything else they may be going through, just not a good way to be. So if you want more information, blackhealthmatters.com. I'm telling you, I'm saying .com, is it .org?
Black.com.
.com, blackhealthmatters.com, whatishingles.com. Get the information. You're 50 years of age or older. Talk to your pharmacist, talk to your doctor, find out what you need to do to protect yourself, and we thank you for being here, for being engaged and wanting to get the information to do better by you, by your family, and by the communities you serve. God bless you.
Thank you all.
Thank you.
Thank you, Dr. Sheri, America's doctor. Let's give her a round of applause.